Good afternoon. The Sheriff of Cook County, Tom Dart, has famously said, I run the largest mental health facility in the country, but for the Los Angeles County Jail. Nearly half of the men and women who are incarcerated in the Cook County Jail are diagnosed with a mental illness, and there's a scarcity of mental health resources to care for these individuals. When I've organized a panel of prescribing psychologists and behavioral health directors of federally qualified healthcare centers to speak to an audience at the NAMI State Conference in Chicago in 2012, the NAMI audience enthusiastically cheered us, even standing up on their seats. They told us that they were excited to learn that there could be more providers of comprehensive integrative mental health care. When I talked with the police chief of one of our more rural Illinois police departments in 2014, as we were lobbying for our prescriptive authority legislation, he first asked me, "Why didn't you call me sooner?" Then he said to me, "Here in central Illinois, our officers use their guns maybe once in a career. Yet they train every week at the shooting range and are tested on shooting acuity every 3 months. But what my officers see every day are members of our community who are suffering with mental illness, who are homeless, and they have nowhere to go. So our officers have to take them to the county jail. They don't belong there. We need mental health resources. I will personally go to our Illinois state legislature in uniform and talk with the legislators, and I'll bring my deputy as well as the sheriff and his deputy. I will call the president of the Illinois Chiefs of Police Association, the Illinois Sheriff's Association, and the Fraternal Order of Police so that they will support you too." In one of our 2014 legislative hearings, a psychologist who was opposed to this legislation talked about how psychologists just needed to work more closely with psychiatrists. One legislator told him, "You want to continue the way things are and have always been. We can't do that. Our system is not meeting the needs of our citizens who are suffering from mental illness. We have to do something different." After our prescriptive authority legislation passed in 2014, clinical psychologist Dr. Lori Rickman-Jones, who had served as the senior policy advisor for behavioral health in Governor Pat Quinn's office, wrote to me, "Just a quick note, Beth, to congratulate you for your work on this historic legislation. You should be commended for your tenacity and your willingness to work with the other trade associations to find common ground to make this happen. Most importantly, we will now have the ability to improve access to thousands more in our state who need care. I know that your work here in Illinois will create a pathway for other states likely to follow." In the fall of 2014, I traveled around the state of Illinois and met with hospital CEOs and hospital medical directors, many of whom are psychiatrists, to create clinical training opportunities for our prescribing psychology fellows. Each medical director, to a person, said to me, "I was your most vociferous opponent while you were lobbying for your legislation. But now that it's the law, look, we need you. Let's just do this together." And we have. NAMI has told us that the average delay between the onset of symptoms and treatment in the U.S. is about 11 years. Why? Because approximately 150 million Americans reside in mental health professional shortage areas, HPSAs. And despite the passage of the Mental Health Parity and Addictions Equity Act of 2008, more than 30 million adults and youth living with mental illness in the U.S. went without treatment in 2020. While there are approximately 106,000 licensed clinical psychologists, there are less than a quarter of that number, just 25,000 psychiatrists, in the workforce. 60% of U.S. counties have no psychiatrists. The federal government estimates that we need an additional 45,000 psychiatrists to meet the prescriptive mental health needs of our citizens. And the shortage is exacerbated by the fact that more than half of those currently licensed as psychiatrists are older than 55. Because of the shortage of psychiatrists, a large percentage of psychotropic medications are prescribed by someone other than a psychiatrist. Fully 79% of antidepressants, 87% of anxiolytics, and 57% of antipsychotics are prescribed by medical providers who are highly competent, but most often have relatively little specialized training in the diagnosis and treatment of mental illness. It's not surprising, therefore, that 50% of depression diagnoses are missed by primary care physicians, and 50% of patients who are treated by PCPs are still depressed after a year of treatment. In a remarkable 2012 study, Princeton University researchers Diane Alexander and Molly Schnell found that in the states in which advanced practice nurses had independent prescriptive authority, the suicide rate plummeted by 12%. As suicide numbers are rising to alarming rates in the U.S. today, the need has only increased for mental health clinicians who can provide comprehensive integrative mental health care. So what are the education requirements for prescribing psychologists nationally? The requirements vary from state to state. The common denominator has been the MSCP, the Masters of Science in Clinical Psychopharmacology. In my state of Illinois, we have multi-tiered requirements that include the MSCP, a series of 7 undergraduate basic science courses, the passing of a national exam in clinical psychopharmacology, the PEP, and the completion of a series of 9 rotations in clinical medicine for a total of 1,620 hours over a period of not less than 14 months, not more than 28 months, not less than 20 hours a week, not more than 30 hours a week. I've worked with my team to create rotation placements throughout the state, and we continue to develop other healthcare systems for training, including in the state and county correctional systems. Prescribing psychologists in Illinois have as much as 17 years of formal education and training, consisting of between 16,000 and 20,000 hours. Healthcare is forever changed in our country. Prescribing psychologists are coming to be seen as providing optimal clinical care in every private and public healthcare setting, treating the underserved and the most at-risk vulnerable members of our community. Prescribing psychologists are and will continue to be strong leaders in the state of Illinois, throughout our country, and around the globe. Prescribing psychologists have the potential to increase access to care by 100% within the next 20 years. As the medical center psychiatrist said to me in 2014, our patients need us. Let's do this together.